Okay, we have briefly introduced basic concepts of medical image processing, as well as some basic operations for medical image processing, such as local operations, uh, frequency methods, low pass filters, high pass filters. Okay, a lot of basic concepts. Okay, next we'll introduce some uh, common applications of medical image processing and analysis. The first one is denoising. Denoising, okay, that is to remove noise from an image. Okay, actually, every imaging modality will bring noise into image. The difference is that the amount of noise. Okay, for example, in medical image processing, the ultrasound images has a lot of noises. Okay, compared with other imaging modalities. Okay, such as CT images or MR images. So how to remove the speckle noise in ultrasound image? Okay, while preserving the features, preserving the anatomical features for diagnosis is a very hot topic in research. So in the following slides, we will briefly introduce a novel ultrasound denoising algorithm developed by our group. Okay. The next task is segmentation. What is a segmentation? Okay, segmentation is to partition of an image into non-overlapping constituent regions, which are homogeneous with respect to some characteristic such as intensity or texture. Okay, in medical image processing, okay, segmenting is a specific tissue or organ from medical images, such as CT, MRI, ultrasound images, to segment a specific tissue or organ from medical images. So segmentation is a very important research direction in medical image processing. So in this lecture, we'll focus on this task, segmentation. And in the following slides, we will briefly introduce some traditional or famous or commonly used segmentation methods. And we will also introduce some advanced deep learning model for medical image segmentation, how to use advanced deep learning models to segment a medical image. The next common task is detection. That is to detect lesions or biomarkers from a medical image for further diagnosis and treatment. The next is recognition. Okay, for example, to recognizing if a tumor is a benign tumor or malignant tumor. Recognition. In many applications, we need 2 or more medical imaging modalities for better diagnosis and treatment. In such a case, we should first register these 2 image modalities. For example, in some applications, we will use both CT images and ultrasound images, or MR images and ultrasound images. In such a case, we should register these 2 image modalities first, and then maybe in some applications, we should also fuse these 2 image modalities, okay, to present the doctors and the physicians a better information, okay, by fusing 2 or more imaging modalities. So image fusion, okay, is another very important direction. Registration and then fusion, okay, registration and then fusion. So first, I will introduce a novel denoising algorithm developed by our group for ultrasound image denoising. For ultrasound image denoising, as mentioned, ultrasound has a lot of noises, okay, due to the underlying physical imaging principles. So actually, these noises will greatly affect the following diagnosis and the following image processing and analysis algorithms. So in such a case, ultrasound image denoising is an inevitable task for ultrasound image processing. Usually, in ultrasound images, the noise is a kind of speckle noise. So what is speckle noise? Ultrasound images are usually corrupted with granular pattern of white and dark spots, which are usually referred as speckle. Okay, the speckle is generated due to the resolution of the transducer, ultrasound transducer. Okay, it is inevitable, okay, in the ultrasound imaging process. Speckle noise has a lot of adverse effects on diagnosis and treatment, and it will also complicate the automatic processing and analysis of ultrasound images, such as segmentation. So remove the speckle noise while preserving the anatomical features is a very important task, okay, in ultrasound image processing. However, the ultrasound image denoising is a very challenging task. Okay, there are a lot of challenges. The most important challenge is that we should remove the speckle noise while simultaneously preserving important features as mentioned. However, how to define a measure that can effectively differentiate image features from the speckle noise is quite difficult, as both the speckle noise and the image features are of high frequencies in most ultrasound images. Usually, intensity-based methods do not work because the intensity distribution of the features and the speckle noise are quite similar. Okay, the intensity distribution of features and the speckle noise are quite similar. So only use intensity information usually does not work. So in such a case, we propose to use both intensity information and frequency information together, okay, to remove the speckle noise while preserving important features. First, okay, I will give you an example to show the advantage of our methods. Okay, you can see this image is the input image, and this image is the output image after denoising, and these images are the results of previous methods. Okay, you can see our methods, okay, can better preserve some detailed features than previous methods. Okay, you may say that the difference is not obvious, but if you take a close look at these results, okay, you can see that our methods can better preserve some details or anatomical features, okay, than previous methods. Okay, as you know, to publish a research paper, we have to compare our methods with classical or state-of-the-art methods. Okay, so if we can get a little bit improvement, it is a good research work. So you can see that our methods, okay, in some regions, okay, our methods, okay, is obviously better than previous classical methods or state-of-the-art ultrasound denoising methods. Actually, the whole idea of our ultrasound image denoising algorithm is quite simple. It is a global optimization framework. Okay, this function is the objective function of the optimization framework. Okay, in the denoising procedure, our aim is to seek an output image, okay, that can minimize this objective function. You can see that this objective function has two terms. The first term is date term. In this date term, we use the date term to not allow that many pixels dramatically change their intensity during the optimization procedure. In other words, that means we not allow there is a big difference between the input image and the output image, okay, between the original image and the denoising image, okay, not allow there is a big differences between these two images. The next term, second term, is the regularization term. Okay, the regularization term is used to control the optimization framework. Okay, the regularization term should have large values at speckle noise and small values at features, so that we can remove the noise while preserving the features by minimizing this objective function. So to achieve this, we introduce a concept in phase domain, phase congruency. So I don't want to introduce more details about this phase congruency, but I will briefly introduce the concept of phase congruency. So phase congruency means that at the feature points, the arrival phases are maximally similar. So that means, in other words, okay, that means at the feature points, the phase congruency, okay, is larger than the phase congruency at the noise points. Okay, at the feature points, the phase congruency is larger than that at the noise points. So based on this concept, we design the following regularization term. Okay, you can see this is a phase congruency. So, okay, at the feature points, okay, the phase congruency is larger, okay, but the regularization term is small. Okay, on the other hand, at the speckle points or noise points, the phase congruency, okay, is small, but the regularization term is large. So that, okay, by minimizing this regularization term, okay, we can better preserve the feature points while removing the speckle points, removing the speckle noise. So here are some more results of our ultrasound denoising algorithm. Okay, you can see our algorithm can better preserving the anatomical features in the input image while removing the speckle noise. Actually, I have uploaded the paper on the Blackboard. Okay, if you want to know more details and see more results, please refer to the paper I uploaded to the Blackboard. So I will carefully introduce the segmentation in the following slides. So in this part, we first introduce other tasks, other applications. The first one is detection. Okay, detection is one of the most common applications in medical image processing. So detection is to automatically detect lesions or abnormalities in medical images. Okay, here is an example. Okay, detection of macrobleed in brain MR images. Actually, we developed a deep learning model to automatically detect the macrobleed in brain MR images. What is macrobleed? Okay, macrobleed is a kind of a small leak of blood vessels. It is a very important biomarker of neurovascular pathology. Okay, it can be used to assess the risk of intracerebral hemorrhage, okay, and can also be used to review the cerebral vascular disease and neurodegenerative dementia, such as AD. So automatically detect the macrobleed, okay, can provide the doctors a very important clues, biomarkers for diagnosis of these diseases. So you can see the detection is very important application and task in in medical image processing. Okay, the next very important application in medical image processing is registration and fusion. Okay, as mentioned in some procedures, we need to register and fuse two or more image modalities for better diagnosis and treatment. So here is an example. Okay, we register and fuse MR images and ultrasound images of prostate gland and provide high-quality guidance for ultrasound-guided prostate interventions. So I have also uploaded this paper on Blackboard because we have no time, we have no enough time to introduce every application of medical image processing. So we will focus on segmentation. But if you are interested in registration and fusion, you can read the paper I uploaded to the Blackboard to know more technical details for how to register the MR images and ultrasound images for ultrasound-guided prostate interventions. Okay, how to provide high-quality guidance by registering and fusing these two image modalities for ultrasound-guided prostate interventions.